2.5 years ago, when I was diagnosed with stage 4 non-Hodgkin's lymphoma, Dr. Deming told me that this experience would be one roller coaster, giant roller coaster, full of many peaks and valleys. And boy, was he right. Looking back now, that is exactly what it has consisted of.
Charlie was the youngest of four boys.
We had kind of a wild house at times.
He was the most organized. He was the most structured.
Our kids seemed to be pretty adventuresome kids, and they enjoy things like rock climbing and snow skiing and canyoneering, and those are the kinds of things that he loved. He loved being outside. He loved nature. He loved gardening. When we first got Charlie's diagnosis, and it was a complete shock.
He had a pretty bad cancer that this wasn't going to go away easily, or maybe not go away at all at that point.
Your life becomes a series of tests and waiting rooms and nurses and doctors and needles and machines and numbers and research, and it's really, really easy to lose your footing in all of that.
And during all that time, Charlie was always, positive, and our family was positive. We were always, I think truly believing that if something happened and it was an aberration and it was going to get fixed, it was going to go away.
As his mom, I went to all the appointments, and I spent the night in the hospitals with him, and I watched him interact with doctors and nurses and his friends, and it became more and more apparent to me how important compassionate care is.
I know there was like aromatherapy. He loved just having somebody come in that didn't quite smell like the hospital. Massage, and sometimes massage was just touching, and you can see how those things helped him. His blood pressure would be lower, his heart rate would slow down. It was it was an observable change.
There is a scientific basis for many of these complementary and alternative medicine therapies. It's imperative we have these services because they do truly provide healing and wellness.
It was more than just the traditional clinical care that made a difference. It was the points of human contact, whether it was from the physicians or his friends or his family members.
When they feel better physically because of these extra therapies and that we hope to introduce, it affects everybody around the patient. And for a family, for a parent like Diane and I, these things helped him, and they helped us tremendously.
What all of these things have in common, though, is human touch. There's a human connection between every one of these therapies and a patient. So when someone's getting massage, it's not just the physical act of pushing on muscles, it's the touch of another human being.
Chuck and I and our family are really excited about providing the seed money for the Charlie Cutler Healing and Wellness Endowment. It would be awesome if when a patient gets diagnosed and they're speaking with their doctors and caregivers, that part of their care plan includes integrative medicine therapies.
Charlie used to say he didn't want to be known because of his cancer. I think Charlie had a very positive attitude during the time that he fought cancer, and all of the things that we're trying to bring to the table for other patients with this endowment are things that helped him accomplish that. And I think Charlie would be really happy that we're doing this.
We're hoping to change lives. We're hoping that Charlie's life and his experiences will change lives.